Hi all, welcome to Eduwizz Academy. This video is taken with an intention to make awareness in candidates who are preparing for Prometric as well as other nursing licensing exam. Now this video is mainly focusing on giving some instructions and tips on how to prepare for your licensing exam. Now, we can see some tendency in the candidates that they used to by heart many questions and the right answer of those questions, which is in fact very troublesome task for them, because within the time bound you cannot study all the questions and its answers. So what is an alternative for that? That is what I am going to discuss in this video. If you study the point or the specific topic or the point that is related to that topic, if you study, you can face any question that comes in relation with this point that you have studied. The simple technique is that instead of studying all the questions, if you study only one point, that one point is enough to make you confident enough to face 10 questions. Now, how it is possible? That is what I am going to discuss here. Now, I am presenting before you 2 points, 2 theory points. So, and I will give the question that has come related with that 2 theory points. Now, straight away we will go to the first point. The first point that I am going to discuss is, you can see in the screen that when you are dealing a psychiatric patient, you should always follow hospital policy. Now, this is a standard protocol in psychiatric nursing that a nurse who is treating a psychiatric patient should always follow the hospital policy. Or in other words, you can say that a nurse should not take his or her own personal decision when he or she is dealing with a psychiatric patient. Of course, if you are treating some non-psychiatric patient or if you are treating some medical or surgical patient, in some situations or in some scenarios, you can take your own personal decision which in fact will not harm you. But that is not in the case of psychiatric patient, because psychiatric patients are very fragile in nature, very fickle in nature. You cannot take your own personal decision when you are approaching a psychiatric patient. So you have to put yourself in a safer zone. How you can put yourself in a safer zone? By not taking your own personal decision. So that is the point. So I will just once again repeat the point. When you are dealing a psychiatric patient, you should always follow hospital policy. That is the point. Now, let us see the question that has come related to this point. The question is stated below, that is, a depression patient has shown much development during the treatment and he became very friendly with the staff nurse. One day, he requested the staff nurse to take to the terrace of the hospital. What should the nurse respond? That is a question actually. Now I will just explain the question. The scenario given here is about a psychiatric patient who is having depression. The depression patient is under treatment and he has shown much improvement from the treatment, and after improving from the condition, he has shown a friendly approach towards the nurse. He became very friendly with the nurse who is treating him, or he is giving care of him. Now, one day, the patient is requesting the nurse to take him to the terrace or upstairs of the hospital. That is the question. And for this request, what should the nurse respond? That is what they have asked us. Now, you have to give the answer. The nurse can respond in many ways. Before that, let us see the scenario once again. Here it is about a depression patient. Depression, the word depression. When it comes into your mind, the first thing should come into your mind is that depression patients are having a higher tendency of getting suicide. or the suicidal thoughts or suicidal tendencies are very much high in depression patient. In fact, that is why we are giving priority for the safety of a depression patient. It is due to this suicidal tendency or thought. Now, it's clearly stated in the question, the depression patient has shown much development and become very friendly with the nurse. Now, when you take a depression patient, they will have higher suicidal tendency or higher suicidal thoughts when their energy level is very high. Now, how you can understand a person's higher energy level? If a person is very energetic or he is having higher energy level, he will be very talkative with others and he will be very friendly with others. He want to show his graceness or he want to show his confidence level. For that, he will be very friendly. He will be very talkative with others. That shows his higher energy level. Now, that is the same in the case of depression patient also. He has become friendly with the nurse. He has shown much improvement. He has become very friendly with the nurse. Now, that shows higher energy level in the depression patient. Now, what happens if the energy level increases in depression patient? Their tendency to get suicide also increases. So, higher energy level in depression patient is a warning sign of suicidal tendency or suicidal thoughts. Now, you can relate the question. Depression patient, he is having suicidal tendency. Now, he has shown higher energy level by making himself improve from the treatment, and he become very friendly with the nurse. From that point, you now understood that it shows his higher energy level. So, higher energy level is equal to higher suicidal thoughts. Now, higher suicidal thoughts he is having. That is why he has asked the nurse to take him to the terrace. Now, what happened if the nurse take him to the terrace? He will try to fall from the terrace and he will attempt for suicide. Now, who will be responsible for that incident? That incident responsibility solely lies on the nurse who took him to the terrace. Because you cannot take your own personal decision when a psychiatric patient requests you something. Because if you take personal decision like this, if you take the patient to the terrace, you will be legally implicated for that. So, in order to avoid those unwanted situations, or in order to make yourself in a safer zone, to place yourself in a safer zone, it is better to follow the hospital policy. Now, you will be provided with 4 options related to this question. In that option, it will be clearly mentioned in one option that the nurse should follow hospital policy. Now, that is the right option you should select. Now, what is the difference? When you study this question, you have studied the right option. Okay, that is fine. Now, this is the depression question. Now, suppose after doing many questions, a question come, instead of depression patient, the question they have stated like schizophrenic patient or OCD patient or bipolar mood disorder patient or maniac patient. Now, for all that question, you have to by-heartedly study this option of hospital policy. Better than that, what is the best way? You just study this point. This point is enough to face any question that comes in any dimension that is related to this point. Suppose if the question is schizophrenic patient or a mood disorder patient or a bipolar mood disorder patient or a maniac patient, whoever the patient will be, that is not our concern. Our concern is that if it is a psychiatric patient, if that psychiatric patient is requesting something to the nurse, what the nurse response should be depending on the hospital policy. So, this is the way how you can approach the questions by simply studying a single point. By studying this single point is enough. Studying the single point is enough to face many questions or any questions that come in relation with this point. It's not over. I can show you one more point. I can show you one more theory point and a question that has come related to that point. And the second point is that always give priority to the patient who is showing actual problem. Now, when a patient is concerned, he may have two types of problem: actual problem and potential problem. The problem that the patient faces at present, or the problem that actually exists in a patient at the given point of time, is known as actual problem. Say for example, pain, fever, shivering, headache, nausea, vomiting, malaise, fatigue. All those are the problem that the patient actually faces now. That is the meaning of actual problem. Now let us see what is potential problem. Potential problem are those problems which may develop in the future, or the problem that actually do not exist at the given point of time but may develop in the future. I will give you an example for that. For example, if you take a chemotherapy patient, a patient who is undergoing chemotherapy, they will be wearing facial mask. Now, why they are wearing facial mask? Because chemotherapy will alter their immune system, or chemotherapy will decrease their immune capacity, which makes them more prone to get infection. So they are having a risk for infection, or risk for developing infection, isn't it? But that infection has not developed yet, but it may develop in the future. That is why they are protecting themselves by wearing facial mask. Now, risk for infection is a potential problem, because that infection will occur in the future only. It has not occurred yet. So, I hope you understood the meaning of actual problem and potential problem. Now, we should give emphasis on treating the actual problem first, because those are the problem what the patient actually faces now. First, you have to solve that problem. Then only you should go for the future problems, isn't it? So, always give emphasis or always give priority for actual problem, or for the patient who is showing actual problem. Okay, I hope you understand the point. Now, let us come to the question that came from this point. Which among the following patient should the nurse first attend? So, they have asked us, they have given four group of four patients. Now, among these four patients, for which patient the nurse should attend first? That is a question. So, the nurse should attend for which patient? The patient who is having actual problem, because we have to give always priority for the patient who is showing actual problem. Now, keep that point in your mind and let us probe into the options. First option is a child with bronchiolitis who is in oxygen administration. Child is having bronchiolitis and he is taking oxygen. Now, can you smell any actual problem in that option? No. Taking oxygen therapy is a good thing, is a rational, is a therapeutic management. That is not an actual problem actually. Now, coming to the second option, a patient with pneumonia who is waiting for discharge advice. A patient who is waiting for discharge advice is not actually facing any problem, or they have not mentioned any problem in this option. Okay, now come to the third option. A patient with pleural effusion with chest tube and reported pain, 9 on 10 pain scale. A patient with pleural effusion is having a chest tube drainage and he has reported pain in which he have stated he is having 9 score out of 10. So, out of 10, if the patient is having 9 pain score, that indicates he is having severe pain, that what he is actually facing now. Okay. Now, let us come to the fourth option. A patient with MI, myocardial infarction, who was admitted 2 weeks back. You cannot smell any actual problem there, because the patient has come diagnosed with myocardial infarction and he is under treatment since for the last 2 weeks. There you cannot see any actual problem. Where you can see the actual problem among these patients? You can see an actual problem only in the third option patient, because in the third option they have clearly mentioned that, in the option C they have clearly mentioned that the patient is having pain. Pain is an actual problem. So, whom should the nurse attend first? The patient who is having pleural effusion with chest tube and reported pain 9 on 10 scale. Now, this group of patients will keep on changing for your exams, but the basic concepts remain the same. If you, when you write the exam, the options may get changed. Only you have to look into the option and find out in which option they have mentioned the patient with actual problem. And for that problem patient, or for the patient who is having actual problem, you have to attend first. That is a simple technique. Now you have studied this point. Now you can face any question that comes from this point. The options may get changed, but the basic, the concept or the core concept remains the same. So this is how you can easily approach the questions. Rather than studying hundreds and hundreds of questions, if you study like this will be I think it's my suggestion, I think it will help the candidate to clear the exams. So this is what I am intended to share with you in this video. So hope you all like the video, and thanks for watching. Thank you.